Hey there, Dr. Askew here. I want to talk to you about a topic near and dear to my heart, sex. Most people don't report having problems, but it is a far more common problem than you would think. Sometimes women aren't comfortable talking about the fact that they may not have orgasms when they have intercourse, or that for some reason the quality of their orgasms has diminished, but it's a common problem. And you may not know it, but as many as 50% of women have never had an orgasm during vaginal intercourse. Now, there are a lot of different reasons why these problems can occur, and that each problem may have a very specific fix for it or a treatment that is specific. If it comes from an emotional problem or a trauma in someone's history, that's very different than if it's because we've got you on some antidepressants that are interfering with the nervous system. But there are a lot of different treatments, and sometimes once we've gotten rid of and ruled out all those external factors, and it's just something that's changed in our body or our anatomy related to aging or hormonal changes, I want to talk to you about some of the other things besides the female Viagra, hormones, other treatments of that nature, therapies. I want to talk to you today about a procedure called the O shot. And the O in O shot stands for orgasm. And this is a wonderful procedure developed by a brilliant physician who was looking to improve a lot of things and discovered that by utilizing specific chemical messengers in our own blood, by taking our own blood and separating out the fraction called plasma and platelets, that the chemical messengers in that fraction of the blood can be reintroduced into our body in certain areas to do different things depending on where we need it. Specifically speaking, to give back healthy orgasms and better vaginal moisture and function, those factors can be re-injected into the clitoris and into the vagina. I know what you're thinking. We make sure that everything's very numb down there and that the procedure is painless. I promise. I almost 100% promise. We do the procedure giving you special medications that make everything numb, and for the majority of women, this will improve the quality of sex, give them better orgasms, more orgasms, hopefully improve the strength of their bladder too. I'll talk about that in another video, but it can fix leakage of urine, the type that happens when women cough and laugh, that most of us develop after we've had a couple of children or as we get older. Specifically though, I want my patients and any viewers to know that if you have noticed that things have changed with your sexual function related to aging or stress or other factors, that there are things that can be done. And if your doctor doesn't know about them, that's why I want to come out there and say, maybe there are other doctors in your area, or if you're in San Antonio, come and talk to me, and I'd be happy to kind of try to get to the bottom of what's going on in your life and talk to you more about whether or not this may be a treatment that gives you some improvement in that. This is an important aspect of all of our lives and relationships, and I want to help you achieve the best sex life that you can possibly have. So come see me at Dr. Rogers Centers, and let's talk about sex.